Protein, total, by refractometry, any source. This code reports any source of specimen. This code reports protein tested for by refractometry. Protein, total, by refractometry, any source. This code reports any source of specimen. This code reports protein tested for by refractometry. Pregnancy-associated plasma protein A, PAPPA. Testing for Down syndrome requires a maternal blood sample. Methods include enzyme-linked immunosorbent assay, ELISA, and Western blot. Protein electrophoretic fractionation and quantitation, serum. Other fluids with concentration, e.g., urine, CSF. The specimen is serum. Methods may be cellulose acetate and agarose electrophoresis. Protein Western blot with interpretation and report, blood or other body fluid. Immunological probe for band identification, each. Western blot is an immunoassay technique that detects and confirms certain antibody proteins in blood or other body fluid. Combining an electrophoresis process with a process that blots or transfers the separated proteins onto a membrane, the Western blot is frequently utilized as a follow-up confirmatory test to assist in diagnosing a specific disease. Protoporphyrin, RBC, quantitative. Screen. The specimen is whole blood. Methods may include hematofluorometry methods and high-performance liquid chromatography. Proinsulin. The specimen is post-fasting serum, requiring special handling. Method is radioimmunoassay. Pyridoxal phosphate, vitamin B6. This test may also be known as PLP. Vitamin B6 is also known as pyridoxine and pyridoxal 5-phosphate. The specimen is plasma, requiring special handling. Methods may include enzyme assay, high-performance liquid chromatography, HPLC, with fluorometric detection, and immunoradiometric assay. Pyruvate. This test is also known as pyruvic acid test. The specimen is blood. Methods are usually enzymatic and colorimetry. Pyruvate kinase. The specimen is washed red blood cells. Method is spectrophotometric kinetic assay. Quinine. Urine is collected by a patient over a 24-hour period. Method is thin layer chromatography. Receptor assay, estrogen. Progesterone. The specimen is surgical tissue. Methods may include sucrose density gradient, steroid binding assay, and enzyme immunoassay. Receptor assay, endocrine, other than estrogen or progesterone, specify hormone. Receptor assay, non-endocrine, specify receptor. The specimen is whole blood or plasma. Methods are radioimmunoassay, gas liquid and liquid chromatography or electrophoresis. Renin. This test may be ordered as plasma renin activity, or PRA. The specimen is plasma. Methodology may include radioimmunoassay. Riboflavin, Vitamin B2. The specimen is plasma which requires special handling or a 24-hour urine specimen. Methods may include high-performance liquid chromatography, HPLC, or fluorometry. Selenium. This test may also be known by the abbreviation SE. The specimen is serum or urine collected over a 24-hour period. Methods may include fluorometry and atomic absorption. Serotonin. This test may also be called 5-HT or 5-hydroxytryptamine. The specimen is whole blood or serum or spinal fluid. Methods may include fluorometry, radioimmunoassay, RIA, and gas or liquid chromatography. Sex hormone binding globulin, Shbg. This test may also be ordered as Shbg. The specimen is serum which requires special handling or amniotic fluid. Methods include CMA or radioimmunoassay. Sialic acid. This test may also be known by lipid-associated sialic acid or LASA. The specimen is serum. Methods include enzyme assay and spectrometry. Silica. Silica is a naturally occurring and common mineral found in sands, clays, and quartz deposits. Sputum induction is performed and silica is detected using light microscopy, electron microscopy, or polarized light. Sodium, serum, plasma, or whole blood. Sodium, urine. Sodium, other source. Blood specimen for serum, plasma, or whole blood. Methods include atomic absorption spectrometry, AAS, flame emission photometry, and ion selective electrode, ISE. Somatomadine. Somatomadine is a protein mainly produced in the liver. The specimen is plasma, which requires special handling. Methodology may use a process of dissociation from binding protein and chromatography, followed by radioimmunoassay, RIA. (84,307) Somatostatin. This test may be performed to measure somatostatin, a hormone found in the pancreas and in the gut. Specimen is plasma, requiring special handling. Method is usually radioimmunoassay. Spectrophotometry, analyte not elsewhere specified. Specimen types include blood, random urine, or a 24-hour timed urine collection. Method is spectrophotometry. Specific gravity, except urine. Body fluids are typically collected by needle aspiration or lavage. The method of testing is refractometer. Sugars, chromatographic, TLC or paper chromatography. Thin layer chromatography or paper chromatography is a method to separate and identify sugars in urine when a metabolic order is suspected. Sugars, mono, D, and oligosaccharides, single qualitative, each specimen. Multiple qualitative, each specimen. Single quantitative, each specimen. Multiple quantitative, each specimen. Methods include gas chromatography and mass spectrometry to test for sugars, mono, D, and oligosaccharides in body fluids. Sulfate 4392, urine. The specimen is a random or timed urine collection. Method is spectrophotometry. Testosterone, free. Total. Bioavailable, direct measurement, e.g., differential precipitation. The specimen is serum. Method may be by radioimmunoassay, RIA, and immunoassay, non-isotopic. Thiamine, vitamin B1. This is also known as vitamin B1. The specimen is whole blood. Methods are high-performance liquid chromatography and thiochrome fluorometry. Thiocyanate. This drug may also be known as nipride, nitroprusside, phenite, lethine, or KCN. The specimen is serum or plasma or random urine sample. Methods may include photometry or chromatography. Thromboxane metabolite, S, including thromboxane if performed, urine. The specimen is urine. Thyroglobulin. This test is also known as TG. The specimen is serum.